my name is Dr. Patricia Ford, and I am a doctor of public health with a focus in preventive care. I also act as a registered dietitian and have been in the health and wellness industry for the last 20 years. I want to talk to you today about how do I know if what I'm looking at in terms of media, whether that be social media, the news, any sort of report that you're seeing online, how do I know if it's accurate or true? And how can I see if this is what's good for me? So the interesting part about health and wellness is we live in our body and everybody has their own food story. So what can happen is when you hear information and it feels like something, it feels good, we act upon that feeling versus something that's accurate or true. I come from a background where I believe in science, I believe in accurate or true information, but I also believe that we don't know everything. And then there's always ways to improve. There's always ways to look at from a different angle. And I think in the health and wellness industry, there is a lot of false claims that cherry pick scientific information and market it very well. And I just want to give you maybe 5 tips on how to look at something if it's accurate. What I'm not asking is for you to forget what you feel and act upon science. I think it's really important to honor how you feel and be convicted and passionate in those beliefs, but just also understanding sometimes your reality is not the reality. And understanding science doesn't really care if you believe it in or not. It's science and it's accurate and it's based upon what we know to date. And there's a lot of brilliant inventions on that science, including the phone, including light, including, circles and how cars work and all the different things. So I think there is a science to nutrition and how that science affects our food and how science affects our body and therefore your health. But I think sometimes it can be confusing because you have money involved, you have leadership involved, and you have just a lot of different things that can make that relationship really confusing. So when you're asking about, okay, is this accurate? Is this true? The first question is who's reporting the information? When you're looking at the validity of something, who's talking about it? And is that person are they trying to represent their own company, their own product? Because more than likely, they might be trying to get you to buy into their product, which is not necessarily a bad thing, but are they skewing that information in order for you to purchase something? And it's done all of the time. So you just want to look at, is there something for them to gain? Again, it's not bad that that's happening, but are you aware that that's what's happening? Because sometimes it's tricky. 2, who conducted the research and who paid for it? Meaning, sometimes what can happen is the person paying for the study definitely wants the results to look good for their company. And that happens, but also you can have companies that pay for the research and do a really good job of showing you the findings in a really objective way. Someone has to pay for it. It's not free. So you want to be in an area where there is objective findings given objectively. Now, if that is in a peer-reviewed medical journal, it's typically peer-reviewed and objective, and the person that paid for it or any conflict of interest is reported. And so you can make that assumption yourself. If it's on a blog or a website, that doesn't necessarily have to be reported and it's not peer-reviewed. But if it's in a medical journal or anything where you have a lot of scientists looking at the published journal, it's been reviewed and edited and peer-reviewed a bunch of times. 3rd, is the report based upon reputable research methodology? Now, sometimes this requires a little bit of training or understanding what that is. Now, I didn't say it requires a degree. You can actually understand research training through your own research, but typically people that do their own education, you're not having a mentor or you're not having someone look at angles but you can't see. So it's good to learn from other people. Self-taught is not always, not never. Sometimes I wouldn't recommend being an expert in your own self-taught course. Having mentors and having coaches makes you a better expertise. So thinking you know everything is actually not wise. So is research done in a way where you've been taught how to do it methodically? How you've had have you been able to look at research in a very I keep refraining from the word educated, because then people get really offended if they're not educated. So you want to learn the tactics of what makes a good research study. So one, ideally, in a gold standard study, you have a control group and then you have the experimental group. Now, sometimes you have studies that are called epidemiological, meaning you're looking at large populations and then outcomes. And so you don't have a control group. That's a different kind of study. But you want, typically, if you're looking at a causal relationship, not an associative, you need a control group and you need an experimental group. And that's going to look at an effective or something caused something else to happen. Okay, two, you want the sample size to be big enough. You want the effects of the experiment to happen on a lot of people. On 10 people is not going to be a good enough sample size to produce enough significance. Also, variation. You want, if it happens to a lot of people, you rule out a lot of different variation, meaning if it happens to 1 billion people, it's most likely to happen to most people. If it happens to 10, you can't really make any sort of legislative law because something happened to 10 people. You can continue the research if it did happen to 10, however. And then, do you have a placebo effect? Is that administered effectively? Meaning, was it truly a placebo? Was it truly blind? Because you have self-reporting bias, you have effects in research that can make it not as effective, and there's all different types of statistics to rule that out. There's different types of bias in research, and it's good to be familiar with them. The most gold standard research is called double blind, meaning neither participants, the control or the experimental group, knew what they were. So it's best to know, I don't know. I don't know if I'm a control group. I don't know if I'm an experimental group, and I'm still agreeing to participate in this research study. That would be ideal. It's also the most expensive and the hardest to conduct. It takes a long time. You need a lot of people, but when it is done and done right, you're going to have really strong outcomes. Typically. So you also want to look on, okay, if I'm looking at this, is this based upon testimonials? Testimonials is someone's story. That's typically social media. Social media is someone telling a really good story and you are learning what has happened in their testimony. That is a strong emotional pull. However, that might not be statistically significant for large outcomes enough to change legislative efforts or public health policy. Are claims too good to be true? If they are too good to be true, they're typically not true. They're typically heightened awareness, heightened effect that will fade over time. If it's published in a peer-reviewed journal, it has gone through peer review, meaning their colleagues and other scientists across the world potentially are looking at this paper and trying to find flaws and asking you to fix it. If you can reproduce the experiment, then you can try to disprove the findings and it's still accurate. It's a good experiment and it's probably true. So you really want the experiment to be duplicatable. If it's not duplicatable, it's typically not going to withstand in research for very long. I hope this helps. These are hard questions to ask. It's typically not exciting. It's typically boring, but then you know that you'll be able to run some analysis to understand if your experiment or hypothesis can withstand scrutiny. Hope this helps.